Hey everybody, this is Dr. George Kosmides. I'm back again. I just had a class break, so I'm back in one of the treatment rooms. I don't want to get in anyone's way. Hey, yes to wellness. Thanks for calling. See Simple, thanks. Lean Body Nerd. Hey, Andrew, thanks for coming back on my scope here. So I'm just back in a treatment room and waiting. It's like about 9 other patients to get my treatment today. So I'm in a patient's shoes. So if you have any questions patient related with MUA, let me know. Hey Oscar, let's crack that egg and get a picture in there. What's up? Hey Lawrence. 2 new members joined today. That's fantastic. So my name is Dr. George Kosmides. I'm a doctor of chiropractic. I'm certified in MUA myself. I'm also a functional medicine doc. I teach diabetes education to doctors here in the state of California. I'm a board-approved continuing education instructor. I actually spoke with the docs out there about my procedure and went over my films with them. Great colleagues. And what I want to do now is just answer questions regarding MUA. If you have chronic back pain, I have an online program if you're interested in Lean Body 360. Yeah, welcome Pearl. Hey, welcome to the program, Pearl. Welcome. Me and Andrew will take care of you for sure. Make sure you get everything that you need. You're going to get the Facebook page request, or you can ask for it yourself. You'll get that within a day. You'll definitely get it within your first emails too. So, Das Vidanya from Russia. Thanks for joining. So I'm here, Mary, MUA. Oh, interesting, Mary. So yeah, I'm here at the facility, Smart Surgery Center in Avondale. I think I've got my position on my Periscope, so I'm position centered here. They do MUA specifically. There's an MD, DO, there's DC, so it's a good multidisciplinary facility, and the whole thing is to get people out of pain. Hey, it's a happy life, but functionally get them out of pain, not just to get them out of pain in the sense of blocking the pain. That's not what I'm interested in at all. I'm interested in getting the motion back. And MUA begins to break down that scar tissue and makes it happen. So I'm so excited, but I have to talk kind of low because I'm in the doctor's office. I'm just sitting in one of the treatment rooms, just like I have in my office, but they're teaching the class out front. So I'm just like a fly on the wall. And HIPAA requirements, I shouldn't put anyone else on camera unless they sign waivers and things like that. But I'm going to try to pinpoint get some of the docs and interview Dr. Kramata on the side here, but he's teaching the class, so it's hard. But he's the one that's going to be treating me. There'll be another doctor to assist him, but I'm so excited. I can't wait. My back is killing me. And again, it's not an unbearable pain, it's just a chronic ache from all the scar tissue and damage I've gotten through football, my injury, and everything I've done to kind of hurt myself over time. So yeah, so if you guys want to ask questions, you certainly can. This will be on my catch.me. This is actually going to be a live feed currently. Hey, Lucretia. And Andrew's hooking it up where it's going to be, I think, on the blog as well. So I'm not sure about the techie stuff. Hey, Grace Hauser. Again, Lean Body 360 is my weight loss, fat loss program. It's doing phenomenal. I'm also getting this chiropractic-based procedure called manipulation and anesthesia because of all the traumas that I've sustained in my life. I've just lost, look at that, all range of motion in my neck. It's not because the discs necessarily, it's because the soft tissue around them has gotten so scarred over time. It's not letting me move, and every year it gets a little worse. And I definitely don't want to be some hunched over 50-some-year-old guy. That's not who I am. So I'm already seeing my mobility kind of lessen. Yeah, Andrew's my web guy, so Lean Body 360. Get in the program if you're trying to lose weight and haven't. If you're obese, if you're trying to get your body fat down, this is a key program to focus on that. 3 new members today, fantastic. Welcome to the group, guys. We're going to do great things for you. I'm there every step of the way. I participate in the Facebook. You get live coaching calls from me. You have an unbelievable members area. You have files being added to the Facebook group, menus, grocery lists. I mean, it's a phenomenal program. I got into this by writing my 4th book, Life Without Diabetes, after losing my father and 2 uncles to the side effects of diabetes. So the Lean Body program was a normal elevation for me. So everyone in my Life Without Diabetes program is now morphing into my Lean Body program because it just makes sense. Body fat is the key. And I don't know if I'm going to be able to scope tonight. Usually I'll scope on Saturdays between 8 and 9. But I don't know how how drugged up I'll be when I leave this facility. So yeah, so Andrew's my webmaster. He's handling it, everything, and I'm gonna try to corner one of the docs here. Amy will sub for me. She probably can. As soon as I can corner one of the docs, I'll get him on camera. See if I can do a little quick interview. I am one of them. That, oh, you're one that great. I'm glad you got in. Yeah, Amy's about ready to teach, but that's how it should be. The best the students can do is become a teacher themselves. That means I did my job. Let me see if any doctors are around. See, here's the office. Let's see, Ed. You know, Ed's son is teaching out front. He's a statistician from Stanford and getting his PhD from USC. He's teaching stats. I think they're taking some x-rays and things now, yeah. So this is a pretty busy clinic. I think my procedure is probably another hour and a half, but just depends on, you know, how long will it take? It's a good question. I'm thinking probably about 30 minutes because they're going to do a full spine. They're going to do my neck, my mid back, my low back, and both hips, especially my right hip. I cannot sit in the chair and really reach my shoe. If I fly, I did a business trip to Salt Lake City, Utah, and it's only like a 40-minute flight. It took me 15 minutes to put my right shoe on because I couldn't physically. I had to wait and stretch out to get to my shoe, and that just reminded me of my dad who could do it because he was so heavy. His belly was so big, and I'm like, I'll never get like that. And here I was like that because of an injury, not because I'm obese, thank goodness. But hopefully that will be fair. I don't know what to expect. You know, I'm a patient all over again. You hear all the stats, anywhere from 50 to 100% improvement in one treatment, and you think, wow, that sounds too good to be true. But you know, that's when you're, like I said, I'm certified to perform MUA in the state of California. But I'm a patient now, so patient's a little bit different perspective. I never thought it would be. It's like when you're a doctor, oh yeah, it's a great procedure, you'll get all this benefit. And as a patient, you're like, wow, man, what can I expect? You know, am I going to be all drugged up all day? Where am I going to be at? So all these questions run through your mind that you know the answers, but now you're on the shoes on the other foot. And that's why I'm doing this scope like this, to give you people who have chronic pain. Yeah, I'm looking forward to, you can't imagine, people who have chronic pain, has a work comp injury, PI injury, have insurance, or if you don't, and you're not getting anywhere, definitely consider this procedure. I mean, consider it, and then once what I'm gonna do is hey, Double Dutch, I'm gonna scope up until they gas me, basically. So my wife will be there. I've already talked to them. Hopefully they'll let me do it. Doctors who have been patients are usually better doctors, in my opinion, just from my experience. You know, I would tend to agree with that. We know your pain, I think, is the key. So when someone comes in with a bad disc problem or they're obese, I know exactly where that, because I was, you know, obese when I was 15. I was like, you know, had the t-shirt on and had the big belly when I was 15 years old. And I had disc pain where I lost my bowel bladder function. I had so much pain I couldn't leave the bed for weeks at a time. So I've been there. So I'd have to agree with you. But I think all doctors want to help. I just think their application of the tools is the key. Yeah, and you have to care. No question, you have to care. I had a lady that had a hard time finding my office last night. She didn't get there till 7:45. I stayed late and helped her. It's a privilege. Yeah, they're still teaching the class. So what this is this is a surgery center, and Intercommon Associates, the same company that hires me to teach doctors on diabetes, hires Dr. Kramada, who's their head, the head teacher. Like, he's technically my boss inside Intercom. Brilliant guy. He's teaching the MUA class to about 9 doctors. I spoke a little bit about my injuries and my history because I'm also certified in MUA. And then what will happen is they'll teach the class, and then they'll all go back in the surgery room, and they have 9 patients scheduled and me. I'm probably, I think I'm going to be last because they're going to spend the most time on it because I'm giving them full range to, you know, teach on me. Is MUA usually covered under medical insurance? You have to ask, and in some cases you have to fight for it. For some reason they'll okay pain injections and other non-forms of physical medicine, but you just have to get your provider and just be tenacious. I'll be able to be more emphatic. I mean, I've seen the results physically. I've been with Dr. Kosmides in post-surgery and patients in tears because they're feeling so much better. I want to feel that way. You're not preying on yourself. Yeah, right. Can you imagine being under anesthesia and then kind of just no? I'm going to leave it to my excellent colleagues. I'm in very, very good hands. I'm very very confident in their abilities. No question about it. But any questions on MUA that I can answer, any questions on the lean body program that I can answer. So, I'm going to pop in and pop out on these scopes. So I said I would do this all day long. I just want you to realize that it's a real option if you have back problems. And here in California, I don't know any other states. I know New York is pretty prolific, but California, it's excellent. We have excellent centers here. How many of these are done? I don't know that number, Jeff. I know in this clinic they do about 50 a month. And they've got three doctors that are trained, the same doctor that I was trained by, Dr. Kosmides, that are here full time. So the idea is you get the MUA, and it's either 1 to 3 visits. I'm just going to get 3, and then you get follow-up rehab, you get adjusted, you get therapy, and I'm going to get that at my office. And then if I need another one, I'll come back in like a month. We'll see what the first one will do, because again, I'm in pretty good shape. A lot of people that get them, I don't know how many athletes have gotten them, but a lot of people, like I was walking through the reception room, several of them are overweight and not in the best of health. So maybe me being a little bit healthier is going to make a difference. We'll see. Again, this is my first time having it done on me. So I think you're a nice man. Oh, thank you so much. Benefit of anesthesia, more rain. Well, they can dial in. Like there's different anesthesias for like emptying the stomach, relaxing smooth muscle, relaxing skeletal muscle. So they can dial that in. So I'm sure, especially when they get to my quad, I've got so much scarring in there. I'm sure they're going to have to dial in for the chemical that relaxes skeletal muscle. And that's what the anesthesiast's job is. So they can be very, very specific, which is totally, as a nerd, I think that is so cool. So I've been, when I did my internship with Dr. Kosmides, the anesthesiologist was dialing different drugs in based on the tissue integrity. And I already told Ed, I said, you're going to find probably as much scar tissue you've ever found in someone in my pelvis. And of course, he just shrugs his head and laughs because he's done thousands of cases. So I'm just another case, which is good. I don't want to be special. Hello, Lynn. Last thing I want to be in a surgical setting is a special case. I'm going to see if I can bike tomorrow. So we'll see. I don't know the answers to those questions. Supposedly, I've heard of people getting up the next day and leaving their canes on the floor or whatever. But I don't know firsthand experience. I don't know what to expect, to tell you the truth. It's one thing to read about it and see it anecdotally, but it's another thing to physically feel it yourself. And thank you so much, Lynn. No one's the same. There's no identical case. Everyone's a little bit different. I mean, all my trauma was my car accident and football. Other people was work and other things. So it just depends on where you're at. Oh, Asif is on. Hey, Asif. Got some great people here. And again, I'm certified in MUA and I have a chiropractic practice that we see 400 people a week at. But my lean body program, my organic work is my I don't know, my love or my joy, as well as this. I meant, how does it help others? Read. I hope you can bike tomorrow. I hope so too. I missed that because it's getting too cold. I had to wear a hat last time and a shirt. So there you go. Ask me that last question, and when you type more than 4 lines, copy and paste it because it rolls so fast. I can't read it fast enough sometimes. Oh, but see, here's the I'm just in an office. It's a treatment room basically, and I'm just scoping from this room while they're teaching the class out front. This particular office is in Avondale. I think I have my location on my Twitter. Oh, Peter is here. Okay, great. Okay, so my videographer is here, and I don't know yet. He said, "Let me go see my video."